Welcome, and thank you for joining. This is the Yale SOM Exchange webinar. Today's topic is how digital technology can empower healthcare consumers. We have a lot to get into, and we have a wonderful team here for discussion, so let's just get right into it. First, let me introduce myself. My name is Greg Licholai. I teach at the Yale School of Management, a capstone course on sustainable innovation in healthcare. And I'm also the chief medical officer at a global company called PRA Health Sciences, which is a contract research and data and informatics company that works with pharmaceutical and biotech industry for drug development. As part of Yale, we've also initiated a number of programs to support and study digital healthcare. Most notably, we have our own study group that's focused on novel healthcare therapeutics, which has led us to work in advisory capacity with the FDA, as well as some of the new professional organizations such as the Digital Medicine Society and the Digital Therapeutics Alliance. So now let me first introduce our speakers on the webinar. Let's start with Sri Muthu. He is a class of 16 from the School of Management, and he is CEO of a venture firm called HealthVenture. Sri, could you tell us a little bit about your background?
Sure, thank you. I've been primarily a technologist I'm just looked at my thing since 1989 professionally. In financial services, and then over the last 6 years switched over to healthcare, and is really seeing very similar patterns in the industry around consumerization that I've seen in other industries. So that's my primary background, and I'm also SOM 2016.
Excellent. Let's move on to Rob Stavert. He's a class of 09, and he's head of clinical affairs at Medumo and also chief of dermatology at the Cambridge Health Alliance. Rob, could you tell us a little bit more about your background?
Sure. Hi, everybody. So as Greg mentioned, I did the combined joint MD MBA program at Yale and graduated from that in 2009. And then subsequently went on and did clinical training in dermatology, which I also did at Yale, and then moved up to Boston afterwards, where I split my time as a clinical practicing acquired this past July by Philips. And so Medumo is now officially a Philips company under the Philips umbrella. And so been a rewarding experience on the clinical side, and also getting to use some of that clinical experience to try and build a digital health startup.
Terrific. Well, congratulations on those achievements. All right, finally, let's move on to Jen White. She is class of 18 at SOM, and she's currently the Senior Vice President of Strategic Partnerships at Klick. Jen, tell us a little bit more about yourself and a little bit more about Klick.
Sure. So, hi, everyone. It's a pleasure to be here speaking with you guys about one of my favorite topics, which is obviously digital health and empowering patients. I've grown up in the digital health industry. I had background was WebMD for 7 years, and then I went to a privately held company that was focused on the same types of products and offerings to physicians and consumers. And today I am at Klick Health. I've been there for about 4 years. And at Klick is a privately held commercialization partner for life science companies. And so ranging from everything to marketing communications programs to patients and to physicians for products that are within the market, to incubating startups like Circulation, which was later exited to Logisticare. We really run the gamut in terms of the different types of ways that we leverage technology to really empower and educate the patient and physician audiences. Terrific. And I graduated in 18 from Yale SOM.
Excellent, excellent. So clearly we've got an excellent group here that has a lot of expertise on this topic. Let's do some ground setting at the start, particularly because if you're like us who pay attention to digital healthcare, digital technologies, there's a lot of noise in this space, and there is in fact some criticism and some cynicism about digital technologies, the impact of digital technologies and digital therapeutics. Let's all get on the same page. Let's define what we mean by digital technologies from the point of view of healthcare. Jen, let's start with you. Can you define what when you hear that phrase, digital technologies, digital healthcare, digital therapeutics? How do you get your arms around that?
Well, it's interesting. So to me, those phrases are three very different niches within what is the broader digital health ecosystem, reaching and engaging our consumers who are leaning in and wanting to have, and also physicians who are wanting to have more power within their managing their own health. And so, when I think about technologies around digital health, I mean, quite frankly, I think of the internet, because you look at WebMD and Medscape, which WebMD went public with Halcyon in '99, and it was actually acquired by KKR in '17. But over the course of that time, it took information that previously was only available, as a consumer. You would go into your physician, they would tell you what was wrong with you, they'd tell you what therapy you had, and you would leave and say thank you. And what WebMD did that I think was really groundbreaking was they said, let us provide you with access to all of this information around conditions and therapies. And at the time when they started it, 99, 2000, I joined in 2006, it was unheard of. And this idea of talking to marketers around, are physicians on the internet? It turns out they are. And physicians are healthcare consumers just like patients are. And so allowing these different audiences to engage in information at a time and place that's convenient for them, in the privacy of their own home, and to also then take it one step further and take information and make it easily digestible by a consumer audience. So taking complicated topics that might feel very stigmatizing, and making it available in language that they're comfortable with is, to me, one of the greatest benefits of this digital health era. And so to me, digital health technology starts with the internet, and then of course it gets more specific from there. But that's how I would answer it.
That's a great overview. Rob, let's jump to you. So, Jen has just talked about digital technologies in sweeping terms, and including bringing information and making really simplifying the experience for patients. Could you answer the question, how do you and your firm define digital technologies, and then how do you approach that from an enabling solution?
Yeah, I mean, I think Jen nicely summed it up. I think in terms of just it's a broad and increasingly broad term about how we think about digital technologies in healthcare is, I guess maybe a kind of encompassing way to think about it is just web or mobile-based technology that allow for delivery of healthcare content and healthcare services that traditionally were accessed primarily through other channels. And from there, increasingly, there's a lot of offshoots of that, be it artificial intelligence-based services, analytics. But that's, I guess, kind of a broad way of how I would think about it. And then in terms of how Medumo, our startup, was kind of thinking about it, actually, in a lot of ways similar to what Jen described. Where we really started the company was recognizing fundamentally challenges in patient education, and it was really the most of the people that were involved at the early stage were clinicians, were providers who were seeing patients, including myself, and recognizing that very often there are just big gaps in patients effectively getting the information they need in order to get the healthcare they need to have a better outcome. And so we tried to think about ways that we might be able to leverage technology to improve that problem. We saw a few gaps in what we thought were the way that hospitals in particular were leveraging the technologies that patients are using the most, specifically cell phones and email, to reach their patients in a way that really felt personalized and really was linked to specific episodes of care, and really started with there to try and see if we could make an impact on some of those problems.
That's very helpful. That's very, very helpful. Shri, tell us from the point of view as a venture investor, you must see a lot of different types of digital technologies. Give us an overview of some of the technologies that you're seeing, and with a particular filter of what do you consider within scope, and what would you consider out of scope as a digital healthcare technology?
Thank you, Greg. So as a VC, let me frame myself first. I always think about exits, right? So I'm always thinking about the product that I'm investing in now in the terms of 5 to 7 years down the road. So when I look at the technologies that are out there today that we call digital technology in healthcare, I primarily break it down into sort of the high-level categories around what are the clients using, meaning end users, what are the providers using, what are the resource managers using, meaning systems and so forth, and what are the data providers using. And this is sort of the same framework that World Health Organization does, right? And so you see things like very customer-centric solution or patient-centric solutions. You see healthcare provider-centric solutions, and you see resource manager solutions, and you see data center solutions and data systems. However, so those who I see today. So we see. I have a maternal health company we invested in, Total Mama, very patient focused. We have a mental health thing out of Yale that Mindness Health, very parents focused and systems focused. But stepping back and looking at this overall framework from a perspective of 5 to 7 years, and seeing this in another industry, is this idea that we used to call banking PC banking, and then we used to call it online banking, and then we used to call it digital banking, and now we just say banking. And it cross-cuts across the entire spectrum. It's kind of to what Jen was speaking to. So in healthcare, I see sort of a similar pattern happening for digital technologies, right? At some point, no one's going to talk about digital technologies separate from healthcare. It's just going to be the frame that we use for everything. There's not going to be a single physician that's not going to use some form of EMR. There's not going to be a single patient that's not going to have some sort of device on themselves, or whether it's a scale at home or Alexa giving them advice, or a watch, or a digital therapeutic product out there. There's not going to be a hospital that's not going to use technology. So it's just going to become the soup that we're in, right? And so then I asked the question for myself, if it's any time, to go back to Jen's comment and Robert's comment, and it's anywhere, my key interest right now is around how does it impact the anyone that we define in healthcare right now? Because in healthcare, we still have this unique proposition. I think we learned this in your class, correct? Physicians are the only ones allowed to practice medicine. And the digital technology has broken that framework, right? Because in banking, it used to be only banks could be banks. Now there are 30-something neobanks. There could be only doctors could prescribe prescriptions in person. I can now get a prescription over the website and have it delivered to my house and have them do a follow-up query to check up on my labs without ever seeing a human being.
Yeah.
Quite fascinating, and timely. The FDA is issuing new guidance documents on approving AI-empowered software as a therapeutic. So quite timely, this shift of definition of who can air quote practice medicine. Building on that, Jen, let's shift to you and consider stakeholders here. So this discussion is focusing on healthcare consumers. Maybe we turn that a little on its side and say, as you're thinking about enabling digital technologies, what stakeholders need to be prioritized in order to reach a level of impact?
Oh, such a good question. So, I mean, I think, again, it goes back to what both Rob and Shri talked about, which is, oftentimes you'll have a technological solution that is targeting one specific stakeholder. So if it's a consumer-facing technology, an app, for instance, it's called MyMe, that I know Shri's familiar with as well, that is focusing on helping patients be more empowered about their autoimmune condition. So then clearly those stakeholders, patients need to understand and be informed about this new technology, how to leverage it, the coaches that are part of the app, the healthcare coaches, helping bring about that better dialogue. But then of course, bringing along the physicians. And so physicians are an interesting nuance of this equation, because as I said at the beginning, physicians are healthcare consumers as well. And either they're consuming the information for themselves to become better practicing clinicians, whether staying abreast of the treatment guidelines and those types of things. And so engaging in content on a Medscape or an UpToDate or an Hippocrates or one of those very specific physician partners, or they need to be ready for the conversation of this more empowered healthcare consumer. And so, it's a shift in terms of, 25 years ago, 20 years ago, the clinician, Dr. Licholai, saying to the patient, you're sick and I'm, going to tell you what to do, as opposed to the patient coming in and saying, well, gee, I researched these conditions. I think this is what I have. And I actually think this is the treatment that might best help me. And so making sure that you're equally educating the physician to be prepared for that conversation so that they know what their patients are going to come in and say, I think is really important. And it's something that has evolved as the different technologies have evolved.
Fascinating. So you mentioned this trend of patients being better educated about their own healthcare. Let me jump to Rob. You're a physician, you're a dermatologist, and you're also involved in these novel digital applications. Tell us from your point of view, the experience that physicians are having today, not the aging physicians like me, but physicians today who are probably used to growing up with tools like the internet, and their experience with some of the things that Jen mentioned of more smarter patients, more informed patients, and I guess are physicians continue to be kicking and screaming, dragged along to this, or are they beginning to embrace some of the changes that Medumo and your colleagues are working on?
Yeah, I think there's a spectrum, certainly. And some, not to overgeneralize, probably some of it there is some amount of that's age related, I think, in terms of, it's probably easier for some of the newer generations of physicians who've been accustomed to using technologies and are at the start of their career compared to folks who are towards the later stages of their career who had been less accustomed to using things and practicing a certain way and are having to make adjustments to how they're practicing. And I think that was something I noticed in particular. I was as I've been training and in my practice, I've been at two different institutions where they were implementing a new EMR. And so going from paper-based charts to EMR. And so there were some physicians who had just elected to retire rather than have to kind of make this big adjustment to their practice. So I think that's, there is certainly a spectrum, I think, probably for the newer generations, and certainly some folks of all ages who are a little bit either more friendly or technology friendly, I should say, or more kind of open to learning and experimenting and trying new ways of practicing. There's certainly a spectrum. I think one thing that maybe I notice with patients I see is there certainly seems to be also a spectrum in what patients expect from the healthcare system. And I think that in some ways is driving some change on the part of healthcare systems. So for example, access in my specialty, dermatology, is a big challenge a lot of places. And for a lot of patients, it's completely unacceptable when they're accustomed to accessing other types of services, healthcare related or not, instantly, and having things basically, delivered to them, accessible via the web, things like that instantly. The idea that you have to, take a half day off work, maybe have to wait a couple months to be seen for an appointment that may last 10 to 15 minutes is just completely, it just seems completely antiquated and completely not in line with their expectations of experiencing a high quality service. And so I think it's one example of how I think patients or healthcare consumers as patients are driving a lot of change in healthcare service and service delivery. It's also creating opportunities for other companies to emerge that maybe are filling in those gaps and meeting the needs of those patient populations in a different way, where the current healthcare system isn't addressing them directly.
Can I build on something that Rob said? Because he brought up such an important point that we hadn't discussed yet, which was the EHR as part of this workflow. And physicians are being asked to do more and more with patients, capture more records, et cetera, with less time, right? And so I think as you're thinking about the stakeholder engagement of physicians and consumers beyond just educating, you have to have tools and technologies that are within their workflow and working well with the EHR. And so, as I think about a technology that Klick developed, my company developed with Boston Children's, their innovation group, it's called HealthVenture, and you can look it up at healthventure.com. But it was a two-folded or two-sided solution. One was taking information that clinicians were already capturing in the EHR and creating it in a more user-friendly format and digestible format for the patient. And then the second piece was actually a patient app, leveraging that information that was the output from the EHR to then create this very immersive VR experience, highly personalized medicine for the patient to take something very, very complex like a colonoscopy and put it literally in the patient's eyes of seeing within their own body. And so, the extent to which these technologies can marry both the EHR and what's happening in that workflow and not increase the workload for physicians, I think is really, it's table stakes. That's something that has to be accomplished.
Yeah, quite interesting. Quite interesting. I mean, it feels like there's a heavy lift here. A little bit of an anecdote. So I was at some conference about 6 months ago, and I happened to run into an individual I did not know sitting outside, and he seemed like a very happy person. And I asked where he was, what he did for a living, and he was a physician. And I asked him the very specific question. You seem much happier than many physicians in private practice that I know. Can you explain that to me? This was his answer. He said, I eliminated the EHR, the EMR from my practice. I only see patients one-on-one. I have a small group of patients that I see, and I do nothing electronic. So let me ask this question to the panel. So if we're focused on empowering healthcare consumers. Let's move over to the patient as a consumer of healthcare. How would you fill in the blank here? Dear doctor, it's important to use EMRs because it empowers patients in the following way.
Today, I don't think it does. I mean, I'm going to put it out there. I think the promise of the EMR is so important, but at this point as a patient, the struggle of getting your information and extracting it from an EHR, the lack of interoperability between, from one system to another, Rob said, you're you're focused on dermatology, you might have one system as opposed to, and then, you might have something completely different for your cardiologist versus, someone else for your primary care physician. And so if those things talk to one another and I had access to it without having to remember 15 passwords, I think that would very much empower me. But so I think the idea is amazing. And it hurts my heart to hear, because I do believe in the power of data. So for a physician to say that they're completely doing away with it and his life is better, I hate that, because I think what is possible when you have this data captured in a way and where your conditions are managed in a holistic manner and all different types of specialists are contributing to your one patient record is, to me, the utopia. I don't think it exists today. And
okay, so
Rob is a clinician, so Rob might tell me I'm totally wrong. And
well, let's go to Rob. So can we put that down as a no or as a not yet from Jen?
I think we're in the midst of a time of change. And I think even in the relatively short time since I graduated medical school, I think I've been a witness to that. And there's some healthcare systems that are further along that curve and some that are still catching up. When I did my internship year, so my first year out of medical school, working as a general medicine internist at a big academic hospital in Boston, which was 2009, 2010, there was an EMR, but there was no ability to communicate with other hospitals electronically, even some that were located, literally across the street from where I was working. And so it was not uncommon to have a new patient you're admitting in the middle of the night and be trying to contact a medical records department that's literally, not even a quarter mile away from you, and then trying to get reports faxed over through the fax machine and standing by the fax machine, waiting for the results of a CT scan that was done, just literally down the street. But today I would say, where I'm practicing in Boston at the moment, certainly a lot of I think the main place I see patients was relatively early in the curve in adopting a large EMR. So there's a pretty robust record system for patients within the system: primary care, specialty care, imaging, lab tests, et cetera. And increasingly an ability for that system to communicate not only with everything internally, but with other hospitals in Massachusetts. And so it's sort of an anecdote, but I think it's progress, and it's these are large, complicated, high stakes systems to change and overhaul, and absolutely we'd love to see things moving that direction faster and more safely. But I feel like I've been a witness to some of this to some of this change, and the story I mentioned earlier, and maybe to Greg, like your point about the provider you mentioned who is very happy. Anytime there's change, especially change in big systems, it's going to create some pain for some people. And I think that, as providers, as patients, we're all adjusting to some of this change. But I think that we all believe that over time it's putting us in a better direction. But ultimately, we'll hope as healthcare providers and patients will be better off for it. But we're in the midst of a time of change right now, I think.
Yeah, change is often painful. So, and Rob, you use the F word of healthcare technology, fax. So, let's shift to you. Break this down for us. So, we want to talk about empowering consumers. Let's talk about empowering patients. How do these technologies empower patients? And if you want to answer the question about EMRs, or if you want to talk more broadly about digital technology.
Well, I think to sort of build on what everybody's been saying. So first of all, I just recently joined the state of Connecticut's Board of Health Information Exchange. It's been a project that's been in progress for 10 years. This is the third time they're starting to exchange healthcare data among all the different various healthcare entities. And my first question when I joined at our first board meeting was, hey, if we can do this relatively easily for pretty much everything else except in healthcare, what's the holdup? And I think Robert spoke about this, about the idea of change causing healthcare is something that people feel so personally about from a consumer perspective, something that physicians feel really personally about from their expertise and their careers and everything else. If I looked at what shifted, right, EHRs only came on board because of meaningful use, right? There was money being set aside to say, you shall go to electronic medical records. Now there's going to be money being set aside to saying that you will have to be interoperable with your data and exchange data. So to your question then, as a consumer, as a patient, as a healthcare consumer, how do I see this? I want to think about healthcare in the way that I think about everything else, which is I don't think about it, right? Mm-hmm. If I want to go look up my taxes or my bank statements or my Lyft records or my Uber records, I just go online and I see it. It's really not a lot of difficulty in finding that pieces of data, right? However, if I wanted to go look up my healthcare records, now it's fax, starting from day one, right? Phone calls, emails, a series of exchanges. I think we're in that transition stage where we're still thinking this is the norm and struggling with the change, when in pretty much every other industry that used to be, I grew up in a culture where you had to go walk about a mile to the taxi station to get a taxi. You had to go someplace to get a taxi, right? I came to the US, it was great. I could call the taxi to my house. And now I don't even think twice about using Lyft or Uber or any of the taxi services. And it just becomes de facto. And I think that's what consumers want with their healthcare, right? I want to be able to pull up whatever modality I have, whether it's voice at home in Alexa, whether I'm in my car driving my Tesla and it's checking my temperature and saying, hey, you look pretty warm, maybe I should cool you down a little bit. Or saying that, you know, I find something in your medical records that you should need to be updated on, or I'd done a gene test and now there's new reports that came in that has an impact to me that it tells me instead of me looking. I think as a patient, that's what I want. I want it to look like pretty much any other consumer product that I have. And healthcare still doesn't think that, right? I spent a lot of time talking to physicians and hospital administrators and insurance that they get digitalization for themselves because there's money coming in, or there's a requirement for data, or there's a requirement for research. They don't get it from the perspective of the digital experience for the consumer requires, as Jen's pointed out, an end-to-end interoperability, right? It's not just the consumer app, it's not just the data app, it's not just the insurance data, it's not the EHR, but it's literally everything in the ecosystem needs to be connected. And that's, I think, where we're going to move to, whether we like it or not. And you see in some of the other parts of the world, by the way, I think the US is actually behind, right? You see some of the folks in Asia and some of the folks in Africa, low resource countries are already kind of moving that way just because they have to, and they don't have this legacy burden that we're carrying around, right? And that's what I think is going to shift, right? We're going to play catch up.
Yeah. So technology starts as science fiction, but it ends up being plastic forks and knives, something that we just use, ignore, and dispose of.
Right.
I'm going to nudge our video participants or virtual participants here to send in questions. We've already gotten a couple of excellent questions, so let me start with the following to anybody on our panel. Can you clarify what is a digital therapeutic, and what are the requirements to differentiate products and services as digital therapeutics? Who'd like to take that on?
Well, I'll start just because it's something I've been involved in pretty recently. So Greg, you mentioned that you're working with the Digital Therapeutics Alliance, and that's actually something I've been involved in over the past year or so as well. And so, I mean, as you look at this movement from digital health, which is, I think, again, a broad term of general health and wellness information delivered to a consumer via some type of a digital technology, whether it's the mobile app or internet or whatever, to a digital therapeutic, you start to increase in terms of FDA, actually looking at the FDA as a clearing the device, for instance. Physicians prescribing the digital technology as opposed to just having it available for general consumer consumption. And so, there's some really exciting examples right now in the industry, ground leaders, groundbreaking leaders like, Licholai for ADHD, where there's clinical trials underway to evaluate the effectiveness of this technology for adolescents with ADHD, in a non-pharmacologic way, but it will be a prescription therapy. That's one really exciting example, and there are countless others. And so to me, it's, having a physician prescribe it, it is the FDA rigor, it's the clinical trials, that's what makes a digital therapeutic in my mind.
Yeah, yeah. What's the role of regulators in the FDA in digital therapeutics? Rob, Shri, do you want to help us understand that?
Rob, do you want to go?
I may not be the best person to answer this one. I think for the company that I was involved in, we intentionally sort of steered around it in the way of trying to really steer away from providing therapeutic or kind of concrete medical advice, more just providing more of the information that the clinics had wanted to have the patients in their hands. And then when there were situations where it called for, physician intervention or anything like that, defaulting to having the patient contact the clinic, contact the physician, and making sure that it was easier for the patient to have that information available. But we saw there were several conversations we had around, how close do we want to get to giving medical advice, or at what point do we start to run under the risk of being under some amount of regulation. And we felt that because it was a little bit nebulous and not necessarily directly the problem we were trying to solve, we kind of steered clear from it.
Yeah, thank you. I can add to that. So, we have been working with the FDA. We're working with them specifically on some of their new piloting programs for digital health and trying to understand their new guidelines. And as a VC, I kind of sort of simplified to my portfolio companies as two perspectives. Do you want to be a vitamin company, or do you want to be a prescription drug company, right? If you're a prescription drug company, you're going to jump through all the hoops that the FDA is going to make you jump through, but you're at least going to be something that is somewhat evidence-based, air quotes here, and has potentially a much higher probability of getting reimbursed by the various payers in the system. Whereas the vitamin industry is a very, very popular industry. It makes a lot of money, right? But there's really no regulation in that space, right? It can be anybody that's happening. And that's typically how I differentiate between these two spaces. I think the FDA is trying really hard, along with some of the other governmental agencies around the world, to try to get their arms around basically an industry that's kind of moving ahead of them. Right? And they're playing catch up, and they're trying to apply. And they see, to be fair, the FDA seems to be smart enough to understand, the folks that we've been working with, that they can't apply just the same processes, the same years-long waterfall processes to digital software, which is typically far more agile, far more scale. Our products within 2 years of being built are now in 3 different countries. That is not something you would think about with a pharmacological intervention, right? So.
Yeah. We're getting a lot of good questions about data and the role of data in the digitalization and the technology enablement of healthcare. So we've touched on it a little bit with the EMRs, but we have a good way to think about healthcare data that comes in this question. Is healthcare data? Yeah, I guess I would summarize by saying, what's different about healthcare data? Is healthcare data more complex than data coming from places like finance and transportation? I mean, it is somewhat shocking, in the example that you gave, Shri, that we can do online banking, but it's hard to do online healthcare. Yet it's our health as opposed to our money. Which is more important? Is the data more complex? Is it more important? What contributes to healthcare being behind other industries in digitalization, whether it's data aggregation or other aspects to it?
Well, I'll take a first pass, and I'd love to hear some of the other perspectives. I've built very large data systems, exchanging data across countries and different industries, both in finance and in academia and so forth. Healthcare data is not more complex. I hate to say it that way. There's one exception. Genetic data is a beast by itself. There's really no other analog in any of the other industries except maybe petroleum. But excluding genetic data for this time, just for the sheer scale and size of it, pretty much everything else in healthcare, and whether it's using HL7 or using FHIR, using some of the standards that we had an intern this summer to basically do an analysis of data strategy guidelines for all our startups, and for both from a privacy and regulatory perspective. The framework is there. It is not more complex. What it is ridiculously unstructured, and very few organizations are really going to using some kind of standardized formats around the country. To use a simple example, if you are moving money between banks, you're using ACH or SWIFT around the world. There is no equivalent standard yet, and I think that's what's driving the lack of. And there was no economic need to exchange data in the past, and so there was really no driver for having this data be available, right, for everybody else. I also think,
people discuss the so-called interoperability problem. Could you define that for us?
It's the fact that I can be in one of the 4 Yale hospitals here and the other one can't see my record. It's the negative of it, right?
Yeah.
We just don't speak the same languages, and there's really no incentive for the existing service providers to allow that to happen. They all claim they are trying to, but that's actually, if you just think from a pure economic perspective, there's no incentive.
Yeah. Mm-hmm. So Rob, let's turn to you. There's and let me frame it this way. There's a new proposal that comes from Health and Human Services to provide data standards that ultimately will require EMR and data companies to provide APIs, which are portals, of course, that allow consumers access to their data and allow consumers to provide access to their data to whoever they choose. Perhaps it's an AI company, perhaps it's somebody else. But I'm going to ask a question about HIPAA. So and this is a question that comes from our audience, is HIPAA an impediment to interoperability? Is HIPAA an impediment to solving some of these problems, like Shri mentioned, that these EMRs don't talk to each other?
I think it's been I think it's a challenge for sure. I mean, impediment is, I think you could use that word, but I would also say a necessary one a lot of times. I mean, patient healthcare information is obviously very important to keep protected and to keep private and make sure that whatever channels are being created are secure. And I suppose you could say that an advantage of the antiquated fax machine system that we had previously was that when it was working, that people had to, the records were stored somewhere under lock and key supposedly, and people had to sign a release, and it was at least an easier physical way to make sure that patient's information was protected safely. I'll say that I think most of the times I find when talking to patients, though, I find that most patients are very willing to have their information be shared amongst their providers, amongst other people involved in their care. And there may be cases where they're exceptions, but they're the exception and not the rule. And so I do wonder at sometimes whether we've the degree to which we're protecting has become kind of more of a barrier. When we were starting our company, it was something that we had to be really, really conscious of when we were kind of starting from the ground up. It took a lot of trust and relationship building to allow this nascent startup to engage with healthcare systems data, and we had to take on some risk too and ensure that all of our all the places we were storing data were going to be completely secure. I think sometimes that can maybe serve as a bit of a barrier for new companies starting up, kind of winning that trust of healthcare systems and allowing them to get some pilot data, get going and get up and running. So I think, yeah, I do think it's been an impediment to some degree, but I think I think in a lot of ways a necessary one, but hopefully as as time goes on, the security amongst, an interoperability challenge will be reduced, and hopefully be able to have a better flow of data, and better interoperability.
So healthcare data has been calculated to double every 120 days or something like that, which means 3 times a year, which means that in the next few years, we will be swimming underneath avalanches and oceans and tsunamis of data. Now, we're getting a number of interesting questions about maybe not the promises, but some of the concerns. If we do solve the interoperability issues, if we do connect all data sources, that's just more data, more information. How does let's take it from a doctor's point of view. So Rob, let's stay with you for a second. So as a doctor, I can't imagine that any individual can stay on top of all the healthcare information that's out there. And as it increases and as we're more and more connected, maybe we should take the point of view of that individual who said, no, I'm going to put my brakes on it. Is this going to just increase the anxiety of patients? Is this going to increase the work burden of doctors? Is this going to, in fact, increase utilization and drive up healthcare costs? How do you answer that?
It's a great question, and I think unfortunately a lot of those outcomes are possible, especially in the midst of a time of change. I think some ways that I see it happening. I mean, I think having that that vast and rapid increase in data, it probably lends itself clinically to more subspecialization. I think because it's harder and harder to be a really broad generalist and really staying on top of your field with the level of expertise that patients will want. And as you have more and more specialization, I think that also lends itself to much more team-based care. And we're already seeing that clinically, with the rise of ACOs over the last few years, and really thinking about patient care being delivered from a group of people, and people needing to understand the different roles that they have within a particular team. I think another aspect of your question, I think it's important for any of the companies or firms producing this type of data to just be really thoughtful about physician impact. And I think that was something that I think we tried to be thoughtful of when we were starting up, and not probably not coincidental that we had 3 physicians on the among our original co-founders. So another anecdote. So right now, if a patient has a concern, they can access me. Some patients will have my phone number. I have 2 work-related email accounts for 2 different places I see patients. Certainly nursing staff and medical staff at both offices have my phone number. And then patients can communicate and do directly through the electronic medical record as well. So there's no shortage of ways of patients to get access. And so one thing that we were thoughtful of from the beginning was we didn't want physicians to feel kind of we didn't want to be adding to physician burden. We didn't want to be adding to channels with our technology of ways that physicians were expected to be accountable for patients reaching them through this way, because most physicians already feel like there's too many channels that they're kind of responsible for managing already. And similarly, we saw a challenge or an opportunity perhaps, where we saw a lot of early stage startups that were showing a lot of progress, that had a great patient experience, and had great tools for capturing data. And it was sort of like in order for these startups to realize their potential, it's sort of saying, all we have to do is, get all this data, and then we're going to give it to the doctor, and then the doctor's going to be able to do all this awesome stuff to take better care of the patient. And as providers, we're thinking, I don't know what to do with all these reams of data coming in. So basically, when we built our company, we made it such that the physician didn't have to do anything. Literally, the physician did not have to do anything. If they wanted to, or if there was a particular scenario where physicians wanted to, we could have custom reports and custom sets of data delivered to them about a particular episode of care, type of episode of care, or patient population, or something like that. But the default setting was basically the physician has to do nothing. And so I think that, recognizing that physicians are already kind of overwhelmed and inundated with all these data sources, and having new technologies be thoughtful about that is really important for them to grow. But similarly on the clinician side, we have to be thoughtful about, recognizing that these changes are coming and trying to prepare ourselves to be adaptable and flexible to manage them.
And actually, if I could build on that a little bit, I also thinking if we look at the cost of healthcare and the consumption of care, Rob, I think, did a great job speaking about the clinicians and the consumer, but also looking at the payers and ensuring that we're effectively aligning incentives so that payers are recognizing the validity of some of these alternative treatment modalities, whether it's telehealth or for behavioral health, maybe it's text-based behavioral care, so that you're using digital health in ways that might be equally, if not more effective, but at least equally effective through a digital platform, thereby maybe freeing up resources in the more traditional healthcare setting. And so I think that's one way of looking at it, so ensuring that the payers are aligned with recognizing the validity of these tools and reimbursing accordingly. But then also, one step further is really ensuring that the patients are automated, so that technologies are automating these kind of low value tasks, if you will. And so using a bot, for instance, to answer very simple Q&A, like I just called in yesterday CVS because I'm waiting for a refill for my daughter's prescription. And I didn't need to talk to a pharmacist. I just needed to know if it was ready yet or not. CVS, the phone, they recognized by my phone number that there was a prescription in the works, and they said, no, it's not. I didn't have to talk to anybody. I got my answer, and that was a better and more efficient experience for both myself, and I certainly didn't need to use the time of a pharmacist. And so it's recognizing and identifying ways that can automate the low value tasks, therefore reserving the time that could be better spent for a pharmacist to provide one-on-one counseling if I have a question about my prescription, as opposed to if it's ready or not.
So Jen, you brought up some great examples. And this, let's shift to, we're getting a number of questions, which are essentially, who's going to pay for this stuff? And you mentioned the payer. How are payers viewing this? Now, let me also bring this up in the context of, this summer, we finally started seeing some IPOs from digital health companies, or at least companies that have defined themselves as digital health companies, and their post-IPO value was in the billions of dollars. So, Jen, let's start with you, but let's open it up to everybody. How is it that we're justifying the business model? Who's paying for this, and how is this profitable?
Yeah, so again, this is right now the heart of the questions that are being asked as digital health evolves into digital therapeutics, and these digital therapeutics go from one-man startup to thriving businesses. It's how do you monetize the offering? And right now the models that I'm seeing in place, I mean, clearly there's the easy direct-to-consumer. The consumer pays for it, whether it's through an app or some type of subscription service. But the other types of models are actually partnering with a benefits consultant, getting into the self-insured space. These large employers who are absolutely looking for ways to not only keep their employees happy, but reduce the spend that they are making on behalf of their employees for healthcare expenditures. And then the final piece is payers are starting to recognize that this is not only an offering that could potentially reduce medical spend, when these types of therapeutics are effective and deliver outcomes, but also could keep their constituents happy, because I would say if you look at the NPS scores of pretty much any major insurer, they're probably not the highest. And it's because, and so how can, payers use innovative models to bring forth solutions that their members might want and benefit from, and also then have reduced costs within their plan. And so what I'm seeing is that digital therapeutics companies are partnering with these insurers on value-based models, where it's once there is a proven reduction in whatever or proven outcome delivered. So whether it's reduction in medication spend or, XYZ days, better quality of life or whatever the claim is, once that is achieved, then the financials are tied to that as opposed to a, $29.95 per month.
Shri, you're focused on the bottom line as a VC, I can imagine. What business models resonate with you when you're looking at startups?
Well, the key question that we ask is the same thing that we actually asked in one of the SOM classes here, NGT 657. Actually, we also asked in your class too, which is who pays? And healthcare is such an odd beast compared to many of the other industry as to the who pays seems to be not the person who actually ends up getting the ultimate benefit, right? And so for me, when I think about it from a VC perspective, we're looking to see where are the multiple sources of revenue coming into that company or to that product. We don't, if I want to see things, I want to see companies that are saying, well, we're going to get some revenue from the consumers because it's a subscription model or freemium model. I'm going to get some money from the employers because it's going to improve outcomes for them. I'm going to get some money from ad sales and marketing because I'm able to sort of recommend appropriate products for consumer direct, so that the cost of providing the service or the care is not marked to one single entity, right? And that's the kind of what I'm looking at when we look at products right now. Very rarely do we find companies that are very successful in just doing one source of payment. It doesn't work anymore. You pretty much have to spread where your income streams are coming in. And because it also functions on the size and the scale of that the digital company is going to be. If you're a digital company just focused, let's say, in New Haven, you have a very different strategy than a digital company that's focused on all of North America. Somebody asked a question about language in Mexico and here and so forth, where there are different payment models. So how do you have to think about that? Most of the all the portfolio companies we invest in are global. So the payment question is absolutely critical because it is very different around the world, whether it's governmental pay or private pay or insurers here.
So we have to go to the lightning round and wrap up. So your niece or nephew comes up to you and says, Uncle Rob, Uncle Shri, Aunt Jen, why should I be excited about healthcare in the future when I grow up? Let's start with Rob. Let's start with you.
There's always going to be a need for it. We're all patients to some degree, and I think we're just scratching the surface at how technology, and the theme of this meeting, how technology can empower patients. I mean, the end goal is that it's to allow patients and us to live healthier, happier, better lives. And so I think there's enormous opportunity, and we're just at the tip of the iceberg.
Healthy, happy. All right, it's only starting. Uncle Shri, why should I be excited about healthcare and technology in the future?
Because you're going to live to be at least 1 in 3 child born today is going to live to be at least 100. So you're going to make it to at least 100, 120, 140. Healthcare is just going to be something that you need to pay for. And hopefully you can figure it out so I can live longer as well.
Are we improving access?
I think it's going to become bifurcated.
Okay. All right. Jen, Aunt Jen, why should we be excited?
I would say because unlike in the past where you had to be an actual physician and go through years and years of very specific training to actually impact healthcare for a human being, you, niece, whoever, you now have the opportunity to improve someone's life directly through all different types of ways, whether it's through content engagement or social media strategy. You can change someone's life through healthcare in a way that was never before possible.
What a wonderful way to end. Thank you, everybody. I think that brought us to the real definition of empowerment of healthcare consumers by technology, by making everyone's life better and getting more engaged with healthcare using all these tools. So I agree. I think there's a lot to be excited about, and very grateful for this wonderful panel. I'm very grateful to be part of this very educational and fun discussion. Thanks very much, everybody.
Bye, guys.
Thank you.